Hello, my name is Harvania Perkins, and I'm a master's student at the Chicago School. Today, I'm going to be talking to you about the respiratory system. I'm going to talk about the purpose of the respiratory system. I'm going to talk about the organs of the respiratory system and their functions. And then I'm going to talk about how the respiratory system works with other systems to maintain homeostasis in the body. So let's get started. So, the purpose of the respiratory system is gas exchange. That's exchanging the oxygen in the air from the carbon dioxide, which is a waste product for the reactions in our body. It's also used to control the pH of our body. And thirdly, it helps us to make sound. So, let's get started with the organs. So, the first organ I'm going to talk about is our nose. So air goes in through our nostrils into the nasal vestibule, which is in the anterior portion of the nose. As we go into the posterior portion of the nasal cavity, we have the nasal conchae, which are indentions or raises in the bony structure of the nasal cavity, which has a mucous membrane, and then we have a narrow openings, which we call the nasal meatus. So the nasal meatus, what they do is by narrowing that air passageway into each nostril, you cause a turbulent effect of airflow, almost like a centrifuge kind of effect where you have eddies that form in the airflow in the nose. And what this does is this allows the heavier particles to settle down and the air itself to go up into the nasal cavity. So, this is one form of protection and the first form of filtering out uh, particulates from the air. Now, the nasal cavity, the membrane of the nasal concha um, secrete mucus, and that mucus traps that particulate, which we can blow through and blow out of our nose. When we get beyond the nasal meatus, oh, and actually right there in that same area on the roof of the nasal cavity, we have the ethmoid bone, which is almost looks like a sieve. It has openings in there, which goes to our olfactory bulb. And so we have where we're able to smell in the superior nasal meatus, and we're able to smell either toxins, things that are toxic to the body, which we can get away from, stay away from, or we can smell things that are beneficial to the body, which maybe like food or something that would be beneficial to the body. Also, beyond when we go beyond the posterior portion of the nasal cavity, we go into the nasopharyngeal area. So, purpose of the nose. So, what our nose does is, I've already talked about how it filters the air that comes in. There are um, capillaries very close to our nasal cavity there in the the membrane of the nasal concha, and that blood warms the air or brings the air that is coming into our nose to the internal temperature because of the heat that's radiating from those nasal capillaries. The third thing that the nose does is that it humidifies. The mucus humidifies or moistens the air that's coming into the nose. And then also with our sinuses, like our frontal sinus and our sphenoid sinus and our ethmoid sinuses, those openings help for the resonance of our voice. So those are the purpose of the nose and the nasal cavity. So next I'm going to talk about the second organ of the respiratory system, which we call the throat or the neck. The anatomical name for it is the pharynx. And the pharynx goes from the upper portion of it is at the top of the nasal cavity or a little bit above the nasal cavity. And then it goes down our oral cavity or mouth goes has the oropharynx that goes into that same region, and then it goes down into the larynx. So this portion of the respiratory system also has a mucous membrane. So again, we're still having where we're having the blood being humidified, where we're having the blood being brought to the temperature, the internal temperature. We also have pathogens being caught by the release of mucus in our pharynx. And then also you have some secretions from our tonsils, which are our palatine tonsils, our lingual tonsils, and then the uvula. Those those lymphoid tissues will also secrete lysozymes and also macrophages, and will start the innate immune response to any pathogens that is encountered in our pharynx area. That's why when we get a respiratory infection, that portion becomes inflamed because of the inflammatory response being initiated there in the pharynx. The pharynx also serves as almost like a vacuum because a vacuum tube, because what you can do is between the epiglottis, between the nasal cavity and the mouth, you can change the pressure. So, like, you can hold your nose and blow, and you can clear your ear or your auditory tube. You can suck, suck back and clear out your nasal cavity in the back, and you can spit those secretions out through your mouth, getting rid of any pathogens or particulates that may have formed in those or have collected in those areas. Also, with the cough response, you can cough up any particulates or mucus or anything that may go beyond the pharynx into the larynx or trachea. Those things can be coughed up and then either spit out the mouth, or you can swallow it, and any pathogens can be destroyed in that pH 2 pH environment. So as we go back down from the neck, our next organ that I'm going to talk about is the respiratory system, is the lungs. So we have the trachea, which goes from the larynx to the lungs. It branches into two branches, our left and right lung, with our primary bronchi. Those primary bronchi each divide into two, and to our secondary bronchi, and those bronchi branch into two to our tertiary bronchi. Now, the bronchi are also lined with that mucous membrane that is still um, secreting mucus to capture any particulates or any pathogens, bringing the air to the proper humidity and the proper warmth. And it's also the air is a passageway, allowing the air, focusing the air that has come in from the outside, focusing it into the gas exchange portion of the lungs. So that further branching goes to the primary functional unit of the lungs, which is the alveoli. The alveoli are look like little cluster grapes at the end of the respiratory terminal. You can tell when you get to the respiratory bronchioles because they no longer have the cartilage rings like or the C shape like the trachea and the bronchi do and the bronchioles do, but they have smooth muscle, which are on the outside of it, which make them a little bit more elastic and able to contract and expand um, under control of the respiratory center. So at the alveoli, you have the alveolar type 1 cell, which is the lining around that air filled alveoli, and that's where the gas exchange goes in, where the oxygen is diffused in to the alveolar cell and then into the capillary, and then the waste products from the blood and the capillaries is diffuses carbon dioxide and waste, which are breathed out when we exhale. So the next portion of the respiratory system that I'm going to talk about is how it interacts with other systems. So it interacts with the nervous system and it interacts with the musculoskeletal system. So the respiratory center that controls the breathing, the rate of breathing, is in the brain. It's in the medulla and the pons. And so that sets the rate of respiration. Um, that is sent to the phrenic nerve, which causes the diaphragm to contract. The diaphragm contracts, extending the volume of the lungs. Also, the intercostal muscles assist with this by raising the rib cage up, allowing the lungs to expand. And then air is actually drawn in by that change of pressure. The air is drawn down into the lungs. So the respiratory center is also in control of our pulmonary plexus, which is a system of sensory nerves that are lining along the respiratory tract, which signal when pick up signals so that we know when we're in distress and when we need to shift from normal breathing. Maybe we have to increase the rate. The vagus nerve uh, takes care of that from the sympathetic nervous system, which is our stress, our stress fight or flight um, nerve. And so what will happen then is it'll shut off the non-essential systems, maybe like digestion and what's going on in the reproductive system that's not necessarily needed for for fight or flight, which is mainly our brain, which takes up most of the oxygen will go to our brain and then also to the muscles that we need either to run or to respond to that threat. So that is how our respiratory system works in homeostasis with the body. Also, I forgot to mention about how our vocalization, our vocal cords in our neck or throat, from the larynx, that allows us to speak. And speaking is important in maintaining homeostasis because it's not just the homeostasis of our personal internal environment, but the homeostasis of our community. So using our vocalizations, we're able to um, tell other people if there's things that are around that can benefit them. We can also warn people about things that could be hazardous. So if I smell smoke, then I can tell that there may be a fire somewhere. So I look with my eyes and I locate where the danger is. And then I vocalize that to the others in my community so that we can get away from any danger and then protect not just ourselves, but also the community of other bodies that are surrounding us. So that is the summary of my presentation on the respiratory system. Now, in talking about how what I got out of this course and how I felt about this course, I absolutely love this course. I love the way that it taught through the systems. The other program that I was in taught through the regions. And so with the teaching through the systems, I was able to keep the big picture and able to see how all of those related, but it still didn't